This is Ashnaran Roy, and I'm diabetic for the last 20 years.
Hi, this is Sunny Rajan, and I have been diabetic for the last 3 years.
Hi, I'm Pradhamini and I've been diabetic for the past 5 years.
I am Abhishek Mittal. I am suffering from diabetes for last 5 years.
India has over 100 million people with diabetes, with an additional 136 million people at the pre-diabetic stage. This isn't just a statistic, it's a crisis, because these figures represent 17% of the world's diabetes cases. And while many might think diabetes only affects older people, the reality is quite different. Nearly 57% of those between the ages of 31 and 60 are prone to pre-diabetes, a critical working age group. Even more concerning, each year over 97,000 children in India are detected with type 1 diabetes, highlighting just how early this disease is impacting our lives. And this is why India is often called the diabetes capital of the world. It's a title that brings responsibility. But there's hope. With the right knowledge, early detection, and access to quality healthcare, we can fight this epidemic head-on. November 14th is celebrated as World Diabetes Day, and awareness on this subject is more crucial now than ever for our country. To get to the bottom of this diabetes epidemic, I visited Apollo Hospitals in Chennai, a hospital that is at the pinnacle of preventing and managing diabetes. I interacted with Dr. Shreevidya, a leading diabetologist, to address all our pressing questions and clear up the confusion around this sweet but serious condition. She has been a leading name in diabetology, not just in Chennai, but in India. As I delved deeper into the diabetes crisis, certain questions kept coming up in my mind. To get clear expert answers, I sat down with Dr. Shreevidya at Apollo Hospitals. Together, we tackled some of the most pressing questions and misconceptions surrounding diabetes.
So diabetes is basically a disease of metabolism, wherein our sugars are not digested, and there is a increase in the sugar levels, which causes multiple complications. There are two types of diabetes. There are multiple types, but broadly we have type 1 and type 2. Type 1 is a disease of autoimmune diabetes in which there is no insulin secretion, and over a period of time the insulin gets depleted from the body and it manifests in younger children. We do have some adults with type 1, but it's very rare. Essentially in India, what we are called as the diabetes capital is type 2 diabetes, which is hereditary. And it is a very big lifestyle disease because of sedentary lifestyle, overeating, not screening enough.
Yeah. First question is, we know India is the capital of diabetes. Why do you think the diabetes rate is rising at this rate in the country?
So we have always been a genetically or race-driven diabetes. If I remember, my grandparents were diabetic. Then my father became diabetic. And I am pre-diabetic. But now what is happening is that we're picking up diabetes much early on. We live longer, but we're not living smarter. We have slowed down, we are sedentary, we have included a lot of processed food in our diet.
What are some of the most shocking misconceptions about diabetes that you have heard from your patients?
Nobody in my family is diabetic. I thought women are only carriers. This from a educated chartered accountant who has gestational diabetes.
Wow.
So what if my child is chubby? Does not mean I don't give him candies and sugars, And why are you stopping me from eating today when I am going to get diabetes maybe 20 years later?
So when a patient says any of these things, how do you address these misconceptions?
Over a period of time, I realized that it is a fear of accepting that there may be a problem. And change is never easy, right? So I take a paper pen, I go the old way, and I say, okay, let's list what all you're eating. And then we realize that most of them, what they're eating is carbs. The fact that you're not eating sweets, so you shouldn't get diabetes, is not true, because there is carbs and there is carbs and there is carbs. So I make them realize that they are not moving enough, they are not hydrating themselves enough, and they are not aware of the calorie, where the source of the calorie is from. And then I leave that with them and say, okay, you think about it for the next 1 week, put a meal plan or keep a food diary, and then come back to me.
So, doctor, this is a funny one. Can you explain why a lot of people believe that diabetes is only caused because of eating sweet foods, and if you don't eat them, you're good?
The concept of sweet is only related to sugar, a direct free sugar.
Yeah.
So, but jaggery, palm sugar, juices.
Yeah.
In Tamil Nadu, we have something called as karupatti, which is a raw form of sugar. Everything is sugar.
Yeah.
So the idea has to be that anything which is sweet is sugar. Okay.
Yeah.
So even if you don't eat sweets, there are a lot of carbs in our diet.
Yeah.
In the form of vegetables have carbs, rice is carb, chapati, roti is carbs,
Yeah.
fruits are carb. But we need those carbs. But not eating sugar or sweets definitely goes a longer way.
And also, like, a lot of people talk about these quick fixes, which actually don't work. Like, they think they're helping with their diabetes, but they actually end up worsening their condition. Do you have anything to say about that?
So when we talk about quick fixes, so what people trying to do is that, say for example, this is somebody who eats like 5 idli in the morning, okay, and they eat a big rice meal, and then they have again the same idli dosa in the night and all,
Yeah.
which is all carbs. Suddenly when they say, okay, I'm going to stop eating, I'm going to do intermittent fasting,
Yeah.
any sudden change in your existing meal pattern without substituting it for the right kind of food is going to end up in cravings.
Right. And then you'll just end up eating extra.
more.
Yeah.
So the worst time for the craving is between your lunch and dinner.
And also, like, when, let's say, somebody is detected with diabetes, how important is it for that person to seek professional help as opposed to just going for home remedies?
Home remedies are good because it comes from a very natural space. But it is important to seek professional help to know whether you are in that phase of diabetes, which can be only managed with diet or diet and exercise,
Right.
and diet, exercise and medication. So the issue with diabetes is that it is asymptomatic at large. Okay, many people pick up their diabetes when they come with for cancer treatment or for cardiac, like a heart attack, or with eye problem. You know, blindness. Diabetic retinopathy is one of the commonest cause of blindness in India, right? So screening regularly, getting your HbA1c checked, getting your cardiac markers like at least a lipid profile along with it, and kidney checking goes a long way in trying to handle the therapeutics of diabetes, also preventing complications.
Right.
So we at Apollo, as part of our preventive health check program, have created a non-fasting as well as a fasting protocol, wherein whether you're diabetic or non-diabetic, you can walk in any time and get a health check done, which includes a HbA1c and a random blood sugar. If you come fasting, it is fasting blood sugar.
Okay.
We also have sugar clinics who handle diabetes specially. We have something called as a care continuum program, where the health mentors pick up their call and talk to people who are on mild, moderate and severe, depending upon their levels, and nudge them every 3 months. And annually we have seen a very, very good improvement in weight plan, in blood pressure control and in diabetes. Also, we have seen that people who have blood pressure and diabetes together are more aware than people who only have diabetes.
I feel assured knowing that our cities are equipped with experts and facilities that ensure the protection and safety of our families. Now, let's consider another scenario. What if someone is not diabetic yet, but they might be borderline? What all could they do to make sure diabetes stays at a distance? How can they prevent diabetes?
So what is pre-diabetes? Pre-diabetes is that state of sugar levels where it is above normal but not in the diabetic range. So for example, a fasting blood sugar between 100 to 125, HbA1c between 5.7 to 6.4. Why is pre-diabetes important? Pre-diabetes is important because if we do not monitor pre-diabetes, you will end up being a diabetic. As far as children are concerned, the pediatric age group is up to the age of 12 years. Children are picking up diabetic or being obese or being in the pre-diabetic range between this age group where we do not want our children to be. So a conscious effort of discretion, having a reward system wherein, okay, eat this right every day, include the greens every day, you will be rewarded with a small dessert once a week, somewhere where to make it a gamified effort.
Overwhelmed with everything you've seen and heard? Well, don't be, because managing diabetes and living with it is still possible. Let us ask the doctor, or better, let us ask some patients how Apollo helped them manage their diabetes.
So Saraswati, can you tell me a little bit about your diabetes journey with Apollo?
Sure. When I came to Apollo, I have diagnosed type 2 diabetes, and doctors here explain everything, and my sugar level is now controlled by exercise and diet foods.
And in my initial time, I felt that diabetes is somewhat bit easier, but after coming to know, I have a different view. It needs to be tackled with some more attention, and also the consultant who is dealing with me has given much more awareness.
Since my treatment actually began at Apollo, so I feel like I'm more in control, and also my health has eventually improved.
For pre-diabetes, we at Apollo are very conscious of how to take it ahead. We have personalized testing and treatment plans both to ensure that you are able to keep your A1C less than 6.4 or achieve a target of less than 5.7.
Diabetes isn't something you have to just accept and live with. We have the tools, and with the right attitude, we can make a real change. I urge each and every one of you to take control of your health by getting preventive tests done.
Take the first step today, because health should always come first. Connect with Apollo and schedule your preventive health test. Call 044 4040 1066.